Epilepsy is a neurological disorder that causes multiple episodes of sensory disturbances, loss of consciousness, or convulsions. Seizures usually begin at infancy, but developmental delays are not prominent until about 3 years of age. 3.4 million people in the United States are affected by epilepsy, with 1 in 26 people in the U.S. developing epilepsy at some point in their lives. There are 150,000 new cases of epilepsy in the U.S. each year. Epilepsy is a serious condition that affects many people, yet sometimes normal treatments don't work. Cannabidiol is one solution to treatment-resistant epilepsy. What is cannabidiol? Cannabidiol, or CBD for short, is one of the many cannabinoids that is found in a cannabis plant. CBD and THC are two main components of cannabis. Both THC and CBD have been found to have many benefits, but the difference between the two is that THC causes you to become high, while CBD has similar effects without the high. CBD has seen to be a positive treatment for many different things, from epilepsy, which we are discussing in this video, to psychiatric disorders such as anxiety and psychosis, preventing diabetes, reducing inflammation with arthritis, reducing addiction to heroin, and many more positive treatments. These findings were mostly derived from studies on animals and some testing on humans. CBD has been proven in multiple studies to have no adverse side effects, and some minor side effects such as changes in appetite, diarrhea, and tiredness. CBD has a low abuse potential in both humans and animals. Despite this, in the United States, marijuana is rated as a Schedule I drug in the Controlled Substances Act, which means that it is supposedly highly addictive and has no medical purposes. This means marijuana is regulated and punished just as much as heroin, LSD, and ecstasy. There are two main types of epilepsy we will be discussing today: Dravet syndrome and Lennox-Gastaut syndrome. Dravet syndrome is a form of epilepsy usually caused by a mutation in the SCN1A gene. Patients with Dravet syndrome face a 15 to 20% mortality rate due to sudden, unexpected death and symptoms including frequent and prolonged seizures, developmental issues, and movement and balance issues, along with many others. In a randomized placebo-controlled double-blind trial of 120 patients with Dravet syndrome, the average monthly frequency of convulsive seizures dropped from 12.4 to 5.9 in the CBD group and 14.9 to 14.1 in the control. This trial is one of the first to show the positive effects of CBD added onto a regular treatment program. The other type of epilepsy, Lennox-Gastaut syndrome, is a rare form of epilepsy only affecting 2 to 5% of patients with epilepsy. However, it is well known to neurologists because seizures are difficult to control and patients require lifelong treatment. In two more trials concerning patients with Lennox-Gastaut syndrome, dosages of 10 and 20 milligrams a day of CBD were proven to be more effective than the placebo in reducing the monthly frequency and drop seizures. Seizures often do not respond to seizure medications, so the recent studies providing evidence of the effectiveness of CBD are good news for patients suffering from this illness. In a study consisting of 214 patients who were treatment-resistant, there was an average reduction of 36.5% of monthly seizures after using CBD for 12 weeks. Another study found that CBD extract seems to work better than purified CBD, so if you have the option, choose a CBD extract. CBD comes in many different forms, however CBD extract and purified CBD, also called isolate, are the most popular. Isolate CBD is cannabidiol in its purest form, most potent, and has no flavor. CBD extract is made using the whole hemp plant and is less potent. It is paired with other oils such as coconut oil. The same study showed that almost 2/3 of treatment-resistant patients saw a decrease in seizures. This is a huge portion of people that are able to have much better lives because of CBD. We should destigmatize the use of CBD in order to promote research and help treatment-resistant patients. If you or a loved one has epilepsy and you are treatment-resistant, think about CBD.